Okay. This is 2002 paper again. From question number 25. Is true or false about vaccine? A. Triple vaccine protects against typhoid, whooping cough, and diphtheria. All these three are caused by three types of bacteria: typhoid, Salmonella typhi, whooping cough, Bordetella pertussis, and diphtheria is the diphtheria bacillus. See that is called foreign bacterium diphtheria. So these three are protected from the by giving vaccine. So in triple vaccine, it prevents diphtheria, tetanus, and pertussis. Not typhoid, whooping cough, and diphtheria. Whooping cough and diphtheria is okay. Pertussis means whooping cough, and it prevents diphtheria, that is true. Gallapatla roge, and tetanus, not typhoid. So the answer is false. Go to question number B. Next question. Oral polio vaccine is recommended to be stored at -20. That is true. -20 is true for storage for 2 years. That is right. But there is another way of storing. Now, after taking it for use, this can be kept at 4 to 8. The normal refrigeration temperature for 3 months. So I think the storage temperature they are expecting -20. Haemophilus influenza vaccine, that is a bacteria who mainly cause children's meningitis. So prevents certain types of meningitis. Haemophilus influenza vaccine prevents certain type of meningitis. True. A history of asthma in the child is a contraindication. No, history of asthma is not a contraindication for vaccination. Rubella vaccine prevents measles. That is false. Measles is one thing, rubella is one thing. Rubella, German sarampa. So measles, rubella vaccine is not going to prevent measles. So answer is false. So go to question number 26. Chloroquine is free of gastrointestinal side effects. Chloroquine has a lot of gastrointestinal side effects: nausea, vomiting, abdominal cramps, headache, and diarrhea. So all are problems with chloroquine. You have to take a full glass of water when you take chloroquine. Alendronic acid is used in the treatment of osteoporosis. That is true. So let's see what is the. It is also called bisphosphonate. Bisphosphonate. This means 2. You can see 2 phosphate radicals. This is 1 phosphate. This is 1 phosphate. That is why it is called bisphosphonate. This is the formula. And you have to remember how to give this, because certain pharmacies, they have issued this drug asking them to take at any time. This is given once a week, 70 milligram tablet. They have to take on the same day of the week, Monday, early morning. Take with full glass of water. they should not take it with milk or tea or anything because it affects the absorption. So it's only water they can use. Swallow the tablet whole. That is, they cannot crush it. You should not crush the tablet. Take the because if you try to crush it, that will cause ulcers in the mouth. That is why you have to stay upright for at least 30 minutes, sitting or standing, but upright position. You cannot lie down. If you lie down, you will get esophageal rash, and never with any food or drink, any other drink other than water. This drug increase bone density and decrease the amount of calcium released from the bones. Bones are always building and also dissolving. Building is it absorbs calcium and build up the bone, and also at the same time some of the cells in the bone are degenerated. So that is called osteoclastic activity. Means build up bone. Other one is osteoblastic. Osteoblastic means degeneration of the bone. Degenerate. So this balance goes on continuing. But the drug alendronic acid reduces the degeneration, removal of calcium from bone. C, clarithromycin is a beta-lactam antibiotic. Clarithromycin is a macrolide antibiotic, not beta-lactam. Beta-lactam antibiotics are penicillin and cephalosporins. So the answer is false. So go to D. Fluoxetine is an antidepressant drug. That is true, antipsychotic drug. It is a second generation SSRI. What is SSRI? Serotonin, selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor. What happens here? Now they take a nerve cell in the brain. So in between these cells, the messages are passing. So the serotonin is the neurotransmitter. So serotonin is released from nerve end, and there are receptors for serotonin. And this part is called synapse because these two nerves are not touch each other. You think so that this is the serotonin act on the receptors, then part of serotonin is reabsorbed. Yeah. But now it is blocked because the drug is here to block it. So more serotonin will be surround here because reuptake is blocked now. So beta action, the depression goes down. Celecoxib. Celecoxib we have to talk in the arthritis story. Celecoxib is an inhibitor of cyclooxygenase 2 enzyme. That is true. Now, cyclooxygenase 1 and cyclooxygenase 2 are there, COX1 and COX2. COX1 is the useful one for us. That maintains the kidney blood flow, that will prevent us from ulcers, stomach ulcers. So COX1 is useful. COX2 is produced in response to inflammation. So COX2 is also causing inflammation. So COX-2 select now when if you use a normal like say diclofenac sodium or ibuprofen, it will suppress both COX-1 and COX-2. Here it is selectively inhibit COX-2, leaving the useful cyclooxygenase, that is cyclooxygenase 1. So answer is true. This is the same thing. The phospholipid, arachidonic acid. Starting this production of these cyclooxygenase start from membrane phospholipids because in our body cells are continuously forming and also destroying. So these destroyed cells produce phospholipids. Then it change to arachidonic acid. Then from arachidonic acid, you get COX-1 and COX-2. Both are inhibited by NSAID, that is non-steroidal anti-inflammatory drugs suppress both COX-1 and COX-2. But if you take a selective one, this one, COX-2 inhibitors will inhibit only COX-2 enzyme. Go to 27. A warning about drowsiness should be given when dispensing of certain drugs. So, carbamazepine, true. Carbamazepine given for epilepsy. So, it can cause nausea, vomiting, dizziness, drowsiness, constipation, dry mouth, all. So, B is terbutaline. Terbutaline is a short-acting beta-2 agonist. Short-acting. What is the other short-acting ones? Is salbutamol. So, salbutamol and terbutaline are both short-acting beta-2 agonists. Now, it does not cause any drowsiness. Methyl dopa, true. Methyl dopa is given to reduce hypertension. So it causes drowsiness. Imipramine, also antipsychotic drug, it causes drowsiness, and but diethyl carbamazepine given for filaria is diethyl carbamazepine citrate, DCE. It is not causing drowsiness. We'll go to 28 quickly. True or false about drugs used in the management of angina. So angina is the blood supply to the heart muscles are blocked in different places. A, glyceride trinitrate tablets are effective in prevention of angina. GTN tablets. True. Remember GTN, glyceride trinitrate, if you take pure glyceride trinitrate, it is a liquid at room temperature. Liquid. Now that liquid is added to some solid material and the tablet is formed. Store at controlled room temperature. Controlled room temperature is 20 to 25. Now, if you say room temperature, it is up to 30. Controlled room temperature is, that is AC temperature, 20 to 25. Other instructions are usual things. This says how to take it. The T half is 1 to 2 minutes. So 1 to 2. It acts. T half is 2 minutes. It acts within 1 to 2 minutes. Action. Sublingual spray, fast action. If you take spray, it has intravenous infusion also. used for unstable angina, coronary vasospasm, left ventricular failure, and hypertension. B. Isosobide dinitrate dilates coronary vessels. 2. It dilates all the vessels, but mainly veins. Isosobide mononitrate does not produce headache. That is false. Isosobide mononitrate is an organic nitrate with vasodilating properties, which is anti-anginal agent. Predominantly, veins to reduce the cardiac preload. So this drug reduce the cardiac preload. Cardiac Isosobide mononitrate has longer duration of action than nitropicillin. They are oral tablets. D. Sildenafil should not be given with any nitrate. That is true because sildenafil also potent vasodilator. It dilates whole blood vessels. So nitrates also do the same thing. So it is bad. Diltiazem belongs to the nitrate family of drugs. That is false. Diltiazem is calcium channel blockers. These calcium channel blockers, you have to remember one thing, diltiazem and verapamil acts on both heart and blood vessels. Ifedipine only on blood vessels. No action on heart. So diltiazem and verapamil reduce the heart rate. So 29, true or false about drugs used in the management of diabetes. Metformin does not cause hypoglycemia. That is true. Metformin is given even for normal person to reduce weight. Obese people are given because it does not act directly on insulin. So metformin never make hypoglycemia. Glibenclamide acts by decreasing insulin output from the pancreas. That is false. Glibenclamide is a sulfonylurea. It increases insulin output from the pancreas. Tolbutamide is preferred to glibenclamide for elderly type 2 diabetic. That is true because glibenclamide is a long-acting drug. Tolbutamide is a short-acting sulfonylurea. Sulfonylureas no. So glibenclamide, if the elderly patient get in the sleep, the patient can go to hypoglycemia without his knowledge, and bad thing can happen. Tolbutamide is short-acting, so 2 to 3 hours. So that is good for elderly people. Sulfonylureas are recommended for pregnant diabetic. Never should give any sulfonylurea for pregnant women. Insulin is recommended to be given by the intramuscular route for the routine management of diabetes. Insulin should not be given intramuscular because fast absorption. So patient can go to hypoglycemia soon if the insulin is given to muscles. So it has to be given subcutaneous above the muscle layer. It should be given here, raise the skin a little bit and give the injection. so always subcutaneous. If it goes to muscle layer, quick absorption, short action will be shorter, and patient will develop hypoglycemia. This is how insulin is given. These are the sites that you can give insulin: palm, abdomen, and this are the areas. Okay. Time up. I think if it is too much, it cannot be loaded. Okay. Thank you very much.